So, 6-year-old, chronic kidney disease, not on dialysis, sick for a couple of days with viral symptoms, some vomiting, low-grade fever. And the reason his parents bring him in this morning is that he's very sleepy and confused. Okay, will we do it in English or in English? Okay, very good.
So guys, we have a 6-year-old boy. So guys, we have a 6-year-old boy, 20 kilograms, with sickness. He is confused. He has a chronic kidney disease. I'm the team leader. Benedetta drugs, Maura circulation, Simone airways, Vanessa monitor, and Bianca timekeeper. So is he here? Is he conscious?
Dino.
Okay. Okay. How is he breathing?
He's breathing a little fast and a little deep.
Okay, please Simone, put oxygen with a non-respiratory mask, 100%. Okay, and Vanessa, put the parameters, please. How is his skin? Pale or?
Pale. He's edematous. He's got some edema.
Thank you. Look for anemia. Right? Then we can start. Airways.
Airways are bigger. Secretions?
No secretions.
Okay, listen to the lungs, please. Do I have a DHB line?
Yes, you do.
Thank you.
He has a saturation of 86.
Okay.
Okay. Crackles?
Bilateral.
Yes.
Okay, please Benedetta, take some exams for
Yes.
Okay, and
So I sent exams for blood count, so kidney function, liver function, and also electrolytes.
It's not good at all. We have to solve that. So try with a flow inflating balloon that gives some positive pressure and just ventilate with.
Does it tolerate it?
No.
No.
Okay.
No.
Okay,
5 minutes.
Okay, leave the pressure, positive pressure. If it's not enough, we go with a real CPAP, okay? Then please, how the circulation?
Both are present, center and peripheral.
Okay.
Blood pressure is 80 on 60,
Okay,
so it's in hypertension.
Okay.
Do I feel time?
Capillary refill time is 4 seconds.
For
Okay,
second.
Benedetta.
Yes.
It could be a cardiac problem with a pulmonary edema, but he's hypotensive. We start a slow bolus of 10 milliliters per kilogram in 20 minutes, but we have to check the
I
liver.
check now.
Yes.
You want it? Okay, there's some overload sign.
Yes, you do feel some hepatomegaly.
Okay, and also edema.
Edema in the ankles, yes.
Okay, so Benedetta, you put 5 milliliters per kilogram
Yes.
in 20 minutes and you prepare 8 minutes. Okay?
So I start a bolus of normal saline solution, 100 milliliters in 20 minutes starting from now.
Okay, then please, Simone, can you check the pupils, please?
Okay, can you help me?
I check the pupils. How is pupils?
Pupils are equal and reactive.
Okay, and then Benedetta, when you're free, you can check the blood. And you can also do electrolyte follow-up care while we wait for the exams. And we proceed, by the way, meantime, we proceed with the exposure and we check the temperature.
Okay.
So can I know the blood glucose?
Your blood glucose is 140.
Can I perform electrolyte point of care?
Yes, you can.
Okay.
They will be back in about 1 minute.
Okay, thank you.
Okay.
There is
And
something in
he is still batting away.
Okay.
He does not like this.
I'll give him free flowing oxygen at least. Okay.
Okay. So can you speak
Just
with the
this,
mom and you can also alert the anesthesiologist that we are a critical patient, okay? And we're gonna start probably inotropes.
This is Papa and Mama.
With chronic kidney insufficiency, how are
We'll be knowing in a minute. The blood glucose is 120.
chronic kidney with bilateral thrombus. So it could be pulmonary edema. We tried with CPAP, but he doesn't tolerate it.
Yes.
The saturation for now is good. It's not febrile, so I'm not thinking about a septic shock for now. Okay. So we started a slow bolus, and if preload time worsens, we have to start epinephrine. Yes.
Now he has a
so
saturation of 8.
Is he still conscious?
yes. Okay, saturation is 80. So please start ventilating him as you can. Here on your left. Thank you.
He does not tolerate that.
He does not tolerate.
No.
Okay, so it's free flowing oxygen. Do we want?
Okay, guys, we have hyponatremia, 129. It's not so good at this solution with solving. Do you agree?
The blood pressure is 70 on
Okay,
the suspension is 8.
Okay, so we start the hydroxide. Okay?
0.01 milligrams per kilo.
And you prepare the infusion.
Yeah.
Okay. Can you call the cardiologist because maybe we'll need something else apart of from epinephrine because we need something that pushes the heart but not do vasoconstriction. Okay. And choosing the yes.
Could I clarify, is he getting a bolus of adrenaline?
Not for now, and then she prepared the epinephrine.
Yeah,
thank you.
So administering
One second. You're ready for labs, Monica?
When you're free, you check for a set milliliters because he doesn't tolerate the ventilation and but immediately so we have to a little bit sedate him with dexmedetomidine. Okay, so we start a bolus of 1 microgram per kilogram and then we put the infusion of 1 microgram per kilogram after. Okay, so if you have the second line, we start also.
Do I have the second line?
Yes, you do.
Okay, thank you. Okay, so guys, problems about this thing. So it's saturation is not good and pulmonary edema. So we have to give him positive pressure. So we have to start CPAP and we start medicine. Okay,
Starting now 1 microgram per kilo of dexmedetomidine. The heart rate is high. Yes, he is going high. Do you want me to
Is he still conscious, reactive?
No, he's not reacting.
Okay, so check the pulse. Was is present? Okay.
I'll ventilate him. Positive pressure fluid.
Yes, okay, he's not reacting, but she started the sedation. Okay, so we can try with the CPAP. Okay?
I have.
Maura, can you check the preload time?
Yes. Is the same preload side or
Yes,
better?
he has hepatomegaly.
Okay.
Correct.
So right now I have a CPAP with
He's on the
100%
CPAP.
oxygen.
Okay.
Okay, so guys, we have a 6-year-old boy with unconscious. So please, when you can just put up some cannula.
Okay.
Yes, yes, please. Okay, unconscious. We are sedating him to in order to ventilate him because he didn't tolerate the ventilation. We have 129 ounces of sodium. It's not so bad. I think the physiological solution we just keep it there, okay? And then Kalium was okay, it's 5, okay. We put the catheter to monitor the diaphoresis. We did blood test, so maybe we have
Yes, there's no urine coming out of the catheter.
Okay. No urine.
No urine.
Okay, please, Benedetta, can you do the ultrasound to check if there's urine in the bladder?
Does it tolerate the
Can you call
cannula?
also the nephrologist? Yes, because he's a
No
chronic
urine,
immunodeficiency, so maybe
Carolina, I'm sorry, no urine at all in his bladder.
Okay, so he's anuric, so we have to give fluids.
Yes.
Okay, so we have to give fluids and we have to give iron drops. Okay.
Did you call someone for the
Yes. Now we call the nephrologist and for just to settle a dialysis for him. Okay. And just for help. Okay, great.
Can I check your
with the eye
saturation is not
in shock.
So what
Yes, io sì, proprio non vedo. 40% oxygen.
Try
Double technique.
the double temperature ventilation. Do you want to start?
Yes, yes.
So I start 0.1 microgram per kilo. Okay.
And what about the bolus? Is the small bolus is still going?
It is done.
It is done. Okay. But I will do another one cautiously. Okay.
Yes.
I will. Okay. So, 6 years old boy with chronic kidney disease. He arrived and he has lost consciousness. We are trying to support the ventilation. We sedated him with dexmedetomidine in order to tolerate the ventilation. We are doing, we are trying to give some positive pressure for the bilateral edema, pulmonary edema. He's really dead. He's not going so good, so prepare the tube. Okay, for the anesthesiologist to come.
Did we look at the heart because it could have a cardiogenic shock?
Yes.
Do you want me to prepare elastics first, right?
Yes, but we have also to do fluids. Okay.
Yes, yes.
Yes. It's not good now to do elastics because it's ibuprofen.
Yeah, you're right. I will start the bolus of 100 milliliters of normal saline solution in 20 minutes.
We are doing in parallel epinephrine at the bolus. Okay. We checked that he is anuric. Okay. So we call the cardiologist, but yes. Vanessa, can you please check the heart? Yes.
Look at the monitor.
Nasogastric tube.
Okay.
Okay.
What do I see is the heart activity? Yes.
It looks very funny. The heart looks quite small, the chambers, and there's a large fluid collection around the heart.
Okay.
Okay, so we have also a cardiac tamponade. So we have to call the cardiosarc, but please Benedetta,
Yes.
prepare everything we need for needle
I know how to do it.
If someone knows how to do it, we can.
Yeah. Okay, so
What's the saturation?
okay, so secondary space, 45-degree inclination to the right shoulder.
So you put down 14 needles.
Okay,
and
yeah,
you
yeah.
make
When
the
we have to put something more stable there.
There's a lot of straw colored fluid coming out.
A lot of fluid coming out.
What color?
Straw colored, yellow.
Yellow. Okay.
But what
Because the surgeon is coming, but they said we should evacuate it.
yes, we did it. We did it. Yeah. So we had obstructive shock due to cardiac tamponade. We are doing fluids, but not so much because of the edema, and so we are doing also epinephrine now in infusion. Okay. I think that solving the tamponade will be better, but we have to continue to remove the fluid. Okay.
As the fluid comes out, still comes out. Okay.
What comes out?
Okay. So we need absolutely a surgeon to fix that. Okay. What can we do, Tim? What can we do to optimize the ventilation? We are doing positive pressure, but
Yes. Yes, and now you can.
Okay, now saturation is getting better, and also the heart rate is lowering.
okay, he's still in shock. because the pressure is low, but we are doing free and fluids. For now, we have to keep going.
Okay. Did he recover some consciousness?
He is starting to back away.
I'll
You
take
again.
up the mayo and keep the seat.
Okay, great.
He says, "What happened? I am scared. I want my mom."
Okay. Don't worry, Nino. We just have to do.
Okay, so you have to keep going.
Okay, Treste, all done.
Thank you.
So we're not going to formally debrief, but just a couple of comments. So what led you to look at the heart? If you're saying the bottle, which is an awesome thing.
Yes.
Why?
Yes.
Okay, because
I thought that it was a cardiogenic shock at first, so I wanted to see the contract.
6-year-old boy who has some chronic kidney disease. Is it okay in English?
Yes.
Okay, all right. But he's not on. Thank you. He's not on dialysis.
Never done that.
He's never been on dialysis. He's been sick for several days with viral symptoms like low-grade fever, some vomiting. Is not himself. The reason that his parents brought him in this morning is because he's very listless, lethargic, and acting confused. So that is the reason they're coming to the emergency department today.
Okay, 6 years. Do you have the weight and position?
When he comes in, he looks to be a chunky little boy for 6 years old.
Okay.
Okay? 6 years. Yeah, perhaps a little overweight.
Okay.
Okay?
Yeah. So we can start?
You may start.
Okay, so guys, our patient, 6 years old boy with the chronic kidney disease coming here for because it's lethargy, it's confusing, like fever, those days, like this name said, anorexia, circulation, Francesca medication, Vincenzo you are the monitor, and Maria you are the timekeeper. So the patient can we hear, this is what we hear about the breath?
This is what you hear.
There is increased work of breathing.
Yes.
What about the color of the skin?
Yeah.
Okay, so put the patient in a comfortable position, apply the multiparameter monitoring, and also support the patient with the oxygen because the patient is lethargic. So we are raising the end of the bed. Now can we okay, perfect.
I use an Oral-B mask to 100%, 15 minutes from minutes.
Okay, we have a low saturation with 87%. Okay, we have a sinus rate of 100 sinus.
Okay.
Okay, and then I apply the.
Okay, perfect. Start with the evaluation of the airway first.
There is a patent.
Yes, the airways patent.
Okay, there are any secretion or bloods or antibodies. Okay. The trachea is midline.
Yes.
Okay. He has a macroglosia or.
Okay, perfect.
So,
The circulation is not improving.
Okay, lower.
Just bilateral, but are these crackles here at the blood basis?
They might be crackles, yes.
Okay. The respiratory rate is
40.
40.
40.
Okay, the other pulse
Okay.
are regular.
Okay. The pressure is a little low.
The central pulse is regular, but the peripheral pulse is quite weak. Are the extremities cold?
The extremities are cool to touch, yes.
Okay, and the relative time,
4 seconds.
there is also hepatomegaly or
There is
distension
some
of the blood.
hepatomegaly.
Okay, no fluctual distinction.
It's hard to tell. He's a chunky 4-year-old, 6-year-old.
can I take a line? Can I succeed in a
Yes.
intravenous line?
Yes.
And I perform blood gas analysis.
Okay, thank you. We have also the neurological exam and the capillary ischemia. Usually we have like cardiac problem.
I mean,
Are the lungs reactive to light?
They are reactive and equal.
Okay.
We perform the glue stick. We have the response.
The glucose, you said? Is that what
The
you're asking?
capillary ischemia.
Oh, capillary reflex, I'm sorry.
No, capillary ischemia.
Oh, glycemia,
Glucose.
yes, 140.
Okay, 140. If you undress the patient, does he have any lesions? Is edema of the
He does have edema.
Okay,
Yes.
so guys, we are patients with chronic kidney disease. Now he has edema, so probably they are suffering now, and also heart probably may suffering because we have hepatomegaly and also jugular vein distension and also crackles. So also a sign of tissue perfusion. So I want to perform fluid, but not so fast because the heart maybe is ugly. Okay, perfect. Thank you.
In my time,
Yeah, thank you. Also because the okay, now the saturation is in range. I will also check about the blood pressure if it goes low because
I think we should wait
similar.
because you told me it's
Okay.
so I will start 10 milliliters per kilo of sodium chloride, 0.9%.
In 20 minutes, okay, very
Yes,
slow,
in 20 minutes.
but check the vital signs. If they increase, stop with fluids and think about the inoculums and vasopressor, okay? Okay, do we have the blood gas analysis?
Not yet.
Okay, okay. So let's prepare for the inaugural inclusion. The patient has essentially cold, so it's probably vasoconstricted. So we can also think about the neurinol to help for the.
The heart rate is increasing.
Okay, okay. Then it's good. The word.
Also the temperature is increasing.
Okay.
What about the liver? Is it large or
It does feel large, yes.
okay, more than before?
No, the same.
What about the crackles?
Freckles seem to be the same.
Should you with the urinary output?
Thank you, Vincenzo.
Okay, the pressure is lowering.
Creatinine.
Okay, saturation is not
You, can we call the nephrology to know about his previous creatinine?
Yeah,
Creatinine?
Absolutely. The nephrologist is right there.
Is the patient still conscious?
He's not talking anymore.
Okay.
ieri
Okay.
ha preso un'infezione virale 3 giorni
But
fa.
there's still pulse.
E appunto non è
Okay. So we have left the nephrology for probably dialysis. Maybe patient in dialysis because he's not urine. Also, consider if you use can we apply it continue positive pressure for the. Okay, stop fluid because the saturation is going down. So maybe the crackles we are.
You can try, but
I stop fluid.
it pushes you away when you try to apply positive pressure.
Okay, so again with the maybe I flow nasal cannula if you have, can we have?
Yes, you may have
Okay,
that.
nasal cannula.
The baby is not conscious anymore, but there's still pulse.
There's the pulse. Okay, so guys, there's also the intensive care unit because the patient may be in arrest. Also the pressure is going down. So perform like glutamine for the extremities is cool, right?
Yes, the pulse is weak, the extremities are still full.
Can you also perform an echography of the heart?
You would like an echo? Yes.
Yes.
That's one.
Okay.
Okay. Do you want to do it at the bedside? You want to focus?
Yeah.
Okay. I'll get you the machine.
Okay, thank you. Tell me when you.
I will tell you when it's here.
I will also consultation is more important because I need to know about the heart.
Of course.
not improving.
Yes. Start preparing the glutamine.
I start to prepare the glutamine. We have to use
The patient is still conscious. The central pulse is present. Always check the pulse. We have interfluid because the saturation went down.
This is your echo probe.
Okay. Perform please echo and you see the.
So you see a very small ventricle cavity surrounded by a large fluid collection.
Okay, so we can have the cardiac.
I didn't show you that.
So we also have thoracic surgery for the necessity to the needing of pericardial.
And hepatorenal and hepatosplenic.
You're too advanced for me, so there's decent flow.
Okay, we are administering the vitamin. So we have a patient of chronic esophageal which is not urinating since yesterday, so it's worsening his renal function, also worsened by increase of the creatinine. It's suffering, probably a pathogenic shock. which was compensated, but now it's compensated. We are trying to help him with the glutamine, which improves a lot the cardiac output. Like in Chicken we have called nephrologist.
Sì, ha detto stanno arrivando, il cardiologo dice che nel caso in cui non riuscisse ad arrivare in tempo dobbiamo fare noi la pericardiocenesi.
Okay, okay. So, tayo itong tempo, the time to coming. Okay, so guys, if someone can perform a pericardiocentesis, let's try with the needle to quite patient below the square process 45 degrees versus the clavicle, the middle of the clavicle.
Okay,
Okay, so we are trying for the, also always check the second ones, because patients will be resting anytime. Okay, we are trying, yeah.
Okay. The pressure is
No,
Yeah, don't actually stick it. Thank you. It's okay. It's okay. Alright, so so you get back some, a lot of yellow colored fluid.
Okay, yellow color fluid. We asked to analyze the yellow color fluid. Also, blood gas analysis for hemoglobin, PCR, PCT, like temperature is 37, right? This is what we see in the.
Yep.
Okay.
L'ultimo diuretico che ha preso è ieri, possiamo pensarci magari.
Yes, thank you. We also perform photosampling to try to have also the image resolvent to find if there is the urine output with just 1 milligram per kilo, because if kidney is suffering, maybe we can get the function worse, but we have to try.
The pressure is improving. The pressure is improving. Is it improving?
Okay, perfect. We are administering the glutamine. Okay, so also let's analyze the fluid that we take from the pericardium. Can we perform again and then another echocardio to see if there is improvement of the.
Yes. Yep, it does look improved.
Okay, it's improving. The saturation is improving. Is region also evaporating?
Okay, the glutamine infusion is finished.
Yes.
Okay, so maybe this time we can try with fluid, check first for the reload signs. Yes, for the divided.
I will start with the furosemide, 1 milligram per kilo, so 25 milligram. I administer, okay? Wait, yes. I will categorize the patients to check the diuresis.
Thank you. All right, the ICU doctor is here and has a few questions for you.
Okay.
Can you just tell me what's going
I
on?
will do for us seriously one kidney failure, a reposition of the kidney failure because of the creatinine, probably a cardiogenic shock. We started with fluid, but the blood time increased, so we administered the glutamine. We also administered furosemide.
Which one? Go what? What did you do?
The glutamine.
Okay.
Then we had the surgery was not available, so we tried ourselves. We did it, so now the patient is stable. Blood pressure was 1 seconds ago.
Okay. How's the saturation now?
The saturation is 94. The patient is with high flow nasal cannula. Nasal cannula.
Between 94 and 94. Do you think he's ventilating? Did you get a blood gas?
Yes, we did blood gas, which. This is the first one. Maybe we can perform another one. Okay. And also we send the blood, the sample that we take from the pericardium to the lung to see if there is any infection.
Okay, good. So is he awake and protecting his airway? I mean, does he need to be intubated? Would you intubate him?
No, I think with high flow nasal cannula, it's okay. Saturation is in range. So if the saturation doesn't drop, we can stick with the.
The respiratory rate is so elevated. Yeah. Just wondering if there's any problem with intubating him.
If he's unconscious, I try with the letter to maintain.
Okay. He gags. He doesn't want that.
No, you try with CPAP, but
he doesn't tolerate it.
Yeah, doesn't tolerate it.
So you stop?
Yeah, so we stop.
Okay.
provide the.
Okay, fair enough. Good. All right. Okay, thank you.
All right. We're not going to do a formal debriefing.
No.
Just
Sorry.
No worries. Just a couple of points. So we got to hear your summary to Mark, and you guys did a really nice job going systematically and ultimately understanding what was wrong. Yes, his shock was cardiogenic, but is there any other name of the kind of shock that he has that you would use? It's
Obstructive.
Yeah, it's sort of it's both, in many ways, but the tamponade technically is a form of obstruction. I really like that when he didn't tolerate the mask, that you went with high flow. What is the potential problem with using positive pressure for a patient with
That
an
you
infusion?
decrease the frequency of the actually the prelude is low.
So you can impair venous return more,
Yeah.
and the heart is not going to fill as much, and so the blood pressure may go down further. You get sort of backed into a corner when the patient has saturations like this and isn't responding to other things, that it's a real crisis. But I like that you used high flow. That was a good interim measure while you brought together your specialists, like anesthesia, because intubating can be very hazardous. Get the nephrologist, because this patient might need dialysis, and the cardiologist. But the cardiologist said, be brave, go ahead and train infusion, which you did, which is the ultimate fix for this. So anyway, you guys did a great job. Thank you.
Thank you.
Thank you. Really.
Gigi, scusami se ti ho buttato il manino.
No, adesso
Perdonami.
no,
Non l'ho fatto tanto.
no, non c'è problema.
Okay.
Guarda, mi sono messa